Hello and welcome to a new video. Today webop would like to present the results of a systematic review and meta-analysis of the association between daily toothbrushing and hospital-acquired pneumonia. Hospital-acquired pneumonia is the most common and morbid healthcare-associated infection, but limited data on effective prevention strategies are available. A systematic review was intended to clarify whether daily toothbrushing is associated with lower rates of hospital-acquired pneumonia and other patient-relevant outcomes. For this purpose, a search was conducted. In PubMed, Embase, Cumulative Index to Nursing and Allied Health, Cochrane Central Register of Controlled Trials, Web of Science, Scopus, and 3 trial registers. The primary outcome of this systematic review and meta-analysis was hospital-acquired pneumonia. Secondary outcomes included hospital and intensive care unit mortality, duration of mechanical ventilation, ICU and hospital lengths of stay, and use of antibiotics. Subgroups included patients who received invasive mechanical ventilation versus those who did not. Toothbrushing twice daily versus more frequently. Toothbrushing provided by dental professionals versus general nursing staff. Electric versus manual toothbrushing, and studies at low versus high risk of bias. A total of 15 trials met inclusion criteria, including 10,742 patients. Effective population size was 2,786 after shrinking the population to account for one cluster randomized trial in non-ICU patients. The outcome: toothbrushing was associated with significantly lower risk for hospital-acquired pneumonia. Reduction in pneumonia incidence was significant for patients receiving invasive mechanical ventilation but not for patients who weren't. Toothbrushing for patients in the ICU was associated with fewer days of mechanical ventilation and a shorter ICU length of stay. Brushing twice a day versus more frequent intervals was associated with similar effect estimates. Non-ICU hospital length of stay and use of antibiotics were not associated with toothbrushing. However, the study has some limitations. The follow-up of the patients were relatively short in some cases, between 5 and 28 days. The study also included patients from 8 different countries, which could limit the generalizability of the results. Despite these limitations, the results of the meta-analysis support the widespread introduction of dental care programs in hospitals. The authors emphasize that routine toothbrushing as a simple and cost-effective method should be considered an essential part of standard care in hospitals, especially for invasive mechanical ventilated patients, for whom the evidence was strongest. The data from the study can now help to develop effective oral care programs for ventilated patients. Thank you for listening, and take a look at our videos on our website www.webop.com. From cholecystectomy over thoracotomy to an amputation, we got them all, with important techniques, anatomy and complications of the operation. Go and see for yourself. Till the next video, and goodbye.